Hi, today we're going to look at a demo of the Expplant IQ application and why it matters for users like Jordan. Jordan is a compliance officer at a community hospital in the United States. Her hospital performs hundreds of implant surgeries every year: pacemakers, spinal simulators, ICDs, hip and knee replacements, devices that are quite literally keeping patients alive and mobile. But Jordan's job isn't just about overseeing the hospital's adherence to clinical and operational policies. She's also responsible for what happens should those devices need to come back out. Sometimes a device is explanted because it failed, sometimes because of a manufacturer recall. And under federal regulation, when that happens, the hospital may be entitled to a warranty credit from the manufacturer. If that credit is worth more than 50% of the original device costs, the hospital is legally required to refund the payer and report it to CMS. The process surrounding that application is complicated. When an explant is performed, the workflow that follows touches almost every department of the hospital: clinical staff who document the procedure, pathology, supply chain coordinating the device return, finance processing the credit, billing, and compliance, Jordan's team, making sure every obligation to CMS is met. There's no single owner, no unified process, and historically, no single system connecting all of it. The result: industry data shows hospitals miss roughly 81% of eligible warranty credits, over $1 billion in CMS overpayments for cardiovascular devices alone. And it gets worse. Failing to claim and report a credit you were owed isn't just a missed opportunity. Under the False Claims Act, it's a reverse false claim, exposing the hospitals to fines of tens of thousands of dollars per case, plus damages. A missed $10,000 credit can easily become a $60,000 fine after penalties. And with FDA Class 1 device recalls hitting a record high in 2025, the volume of these events is only growing. Jordan's team has been managing all of this with spreadsheets, email threads, and manual follow ups across 5 different departments. The compliance risk is real, the financial exposure is real, and there has to be a better way. The challenge Jordan faces isn't really a compliance problem at its core, it's a data problem. The information she needs already exists somewhere in the hospital. It's just scattered across EHRs, supply chain systems, vendor portals, and recall databases, with no single platform to bring it all together and make sense of it. InterSystems has spent decades building exactly that kind of platform, one designed from the ground up for healthcare's most demanding data environments. The InterSystems technology stack is designed to enable seamless interoperability across clinical and operational systems and to streamline high stakes workflows in a way that is both fast and reliable. InterSystems prides itself on engineering systems whose data integrity stands up to regulatory scrutiny on principle. It makes connecting disparate systems and uncovering meaning that's unintelligible within any single workflow, but obvious once the data is connected, easy and actionable. And for compliance leaders like Jordan, working for a hospital running on InterSystems means her mission is suddenly a lot less complicated. Explant IQ is a demonstration of what becomes possible when those capabilities are pointed at a specific high-stakes problem. Explant IQ is an intelligent data application built on the InterSystems technology stack. It pulls together data from the EHR, supply chain systems, vendor RMA portals, and FDA recall feeds into a single real-time view of the hospital's entire warranty claims workflow. Clinical staff don't change a thing about how they work. The platform is already capturing their documentation and extracting the relevant information for administrators. Explant IQ simply transforms that data into the compliance intelligence Jordan's team needs to act. Let's take a look. When Jordan opens Explant IQ, the first thing she sees are the KPI scorecards at the top of the dashboard. The numbers give her an instant pulse on her program's overall health. 100% recovery rate. Every eligible warranty credit this year has been captured and processed. 0 noncompliance incidents. Not one False Claims Act exposure, not one missed refund obligation. For a compliance officer, that is perhaps the single most important 0. But the dashboard isn't just confirming that things are going well, it's helping Jordan stay ahead of what's coming. 11 explant procedures are scheduled in the next 90 days. That's not just useful for the OR. It means Jordan's team and supply chain can prepare before each of those cases close, rather than chasing them down retroactively. And the average resolution time is just over 24 days. What was once a manual process that spanned months now completes routinely within a matter of weeks. One title that always draws attention is the highest device failure rate. The ST neurological pulse generator is the highest right now at 2%. With InterSystems, modeling data to write KPIs that can help steer purchasing decisions and minimize risk is easy. When observing the device categories by explant rate chart, she can get a read on whether there are any devices that stand out from the clinical mix to impose risk. This is the kind of view that turns operational data into a vendor conversation and eventually into a procurement strategy. Elsewhere, the process compliance and on-time returns trend chart tells the improvement story Jordan is most proud of. On-time return rates and credit recovery compliance have both climbed steadily over the past few quarters, the direct result of automation replacing manual follow-up chains. And then there's the Expplant claims by year bar chart. There's a notable spike in 2025. That much is clear immediately. Jordan knows roughly what happened that year, but she wants the specifics. Her favorite widget is the AI Assistant. For any numbers that pique her interest, she can query. I see a spike in recalls in Q4 2025. How many recalls were issued during that time? When we chat with the assistant, InterSystems Text-to-SQL functionality associates the prompts with the relevant tables needed to construct a SQL query to answer it. The system responds with an exact count drawn directly from the underlying data. No report requests, no additional consulting, no waiting. Says there were 3 recalls issued in Q4 2025, and she can give a follow-up. Give details on the recalls issued. The prompt, along with the relevant table schemas, are sent to a large language model, which is creating a SQL statement across the data structures, executing the SQL statement, returning the results, and summarizing it in a human-readable form, which is being displayed as the response. Device names, manufacturers, recall classifications, all without having to change tabs. And then the question that closes the loop. This is the top 5 procedures contributing to warranty credits recovered in Q4 2025. The assistant helps her understand the financial story of that spike, which procedure types generated the most credit value, and where the compliance team's attention paid off the most. Under the hood, this isn't magic. It's Text-to-SQL running directly inside the InterSystems platform. Jordan isn't a data analyst. She doesn't need to be. She just asks the question, and the platform does the rest. What we've seen today is a hospital that went from manually tracking explants across 5 departments, missing most of its eligible warranty credits and running constant compliance risk, to a system where every device is tracked, every obligation is met, and every dollar of value is recovered. InterSystems made that transformation possible not by layering on a new tool, but by providing a foundational platform capable of powering all of it. Every capability we saw in Expplant IQ, the real-time data unification, the embedded analytics, the workflow automation, and the AI-powered assistant, was delivered by the InterSystems platform itself. No external services needed to be developed, no dispatch to a separate analytics tool, no additional integration required. One platform combining clinical and operational data with an embedded analytics engine and AI capabilities that live right alongside the data they operate on. The result is a decision-grade intelligent data application, one that doesn't just report what happened, but helps the people responsible for outcomes understand the driving factors and weigh what to do with confidence. Enabling that kind of problem solving with unified, trustworthy data is what InterSystems is all about. Thank you.